Lung cancer is actually the second most commonly diagnosed cancer in the United States. In our area, it is unfortunately higher just because there is a higher incidence of smoking, which, as we know, is probably the biggest risk factor for developing lung cancer. However, there is a significant percentage of people who develop lung cancer who've never smoked. Those are the people who might have an occupation that predisposes them to lung cancer, even though they've never smoked.
Oftentimes, a patient will come in with a cough or coughing up blood or shortness of breath or chest pain, and their primary care physician will take a chest x-ray and they may see a spot, and that is confirmed with a follow-up chest CAT scan. And then where do you go from there? Well, we don't treat without 100% certainty of what the diagnosis is. And that's where the pulmonologist or thoracic surgeon will come in. They will do a bronchoscopy, do various washings, biopsies, and from that we can often get the diagnosis.
In general, lung cancer, as most solid organ lung cancers, get treated based on stage. And so, traditionally, early stage lung cancers have been treated with surgery. Other cases, when you have more advanced lung cancer, it usually gets treated with multimodal therapy, meaning a combination of either chemotherapy, radiation, or surgery, or all three.
We provide a consultation appointment for all patients with a new diagnosis of cancer within 1 or 2 business days. And what we do is let the patient know that A, the whole team is there for them, and B, somebody is now actively working on their care, and we rapidly put together the multidisciplinary team, the radiation specialist, the surgeon, anyone else they might need to attack their cancer.
Having all of those specialties under one roof, both in terms of being able to see the patient on the same day, or being able to discuss all the cases in one room, is a benefit to everyone, but most obviously the patient, in that they only have to come in once and say, here's a plan, and we're all on the same page.
We are also very fortunate here to have our affiliation with the Beth Israel Deaconess Medical Center, and so that allows us to really broaden our capabilities and an extra plus and sophistication for the care of our patients.
One of the big reasons why lung cancer is so tough to treat is that often it's not detected until it's at a very advanced stage. So there's been a big push in the last 2 decades to develop an early screening test, and we've actually been lucky enough in the last 6 years to offer a program that does that, and that's called low-dose lung screening.
What's happened is that for smokers who have smoked for more than 30 pack years and who've quit within the last 15 years, from 50 to the age of 77, it's recommended in the appropriate patients to do a low-dose CAT scan on a yearly basis. And then depending on what we find, that determines how often these patients will need CAT scans.
I see treatment of lung cancer following the paradigm of breast cancer treatment. We're diagnosing it early, whether either surgery alone can cure it, but hopefully eventually we find it at a stage where it's so small we're not even going to do surgery. We're basically going to zap it from the inside and not even have to remove any lung. I think in the next decade, that's where it's going to go.
Cancer care in the Green Cancer Center is very individualized, very personalized, and very precise. I'm proud to say that in the Green Center we have highly successful patients across the spectrum.